In parental alienation, a child is rejecting a parent for a non-protective reason. In other words, that parent is safe, the child is protected and safe with that parent, and there was an unreasonable rejection due to an alienating influence. These children are going along with their alienating parent to reject a loving parent. So I actually think my job is kind of easy. The hard part is getting the court to realize that their rejection is counterintuitive, meaning that the children really don't mean it when they say they don't want to ever see a parent again. So once I get the court order, the rest is fairly simple, and I specialize in a 4-day intensive reunification program. I call it a therapeutic vacation because it's a combination of talking and activities that the child likes, and these children jumpstart a reconnection. They do need follow-up outpatient therapy when they go home with the alienated parent. And I stay involved in making sure that the therapist is qualified and knows how to maintain and enhance the reconnection. They got on planes from across the country, from California, Florida. They took 4-hour car rides from Delaware and Maryland to New York, and they came voluntarily. That's how easy it is to get them to come once the court frees them from the loyalty conflict. In other words, what the American Professional Society on the Abuse of Children described as a caretaker abusive behavior known as terrorizing the child, to put the child unnecessarily in a situation to have to choose to have a relationship with one parent over the other. So when the court actually frees the child from this loyalty conflict, which is a form of child abuse, profound psychological child abuse, it's like an albatross lifted away from around the child's neck. And they do come voluntarily. Kids who threaten to kill themselves, to run away, to self-harm, to do all sorts of things, that is just part of the programming that they are freed from with the court order for Turning Points for Families. And we have a lot of research about how profoundly dysfunctional and unstable an alienating parent is. Let's face it, a normal parent will not try to undermine the relationship between the child and the other parent. A normal parent appreciates that the child has a need for the other parent. And when the alienating parent can't appreciate that, they lack empathy, for one thing. The research shows that alienating parents in the severe category, and probably in many moderate category, tend to suffer one or more cluster B personality disorders. And outer behaviors are at great variance with the social norms of the culture they live in. This alone should scare the daylights out of judges that this is being modeled for the children. It should scare therapists. We, as professionals in this field, are in a position where we are supposed to be rearing socially appropriate children to conform to society. Judges are there to enforce social norms and the laws. When they ignore this influence on the child, they are unwittingly participating in child abuse. They really are. They don't know it, they don't realize it, they're not educated about that, because I would say probably 90% of my profession, the mental health profession, don't get it either. But we are all unwittingly participating in creating children who are behaving in antisocial ways, totally unfeeling for the rights of the rejected parent, the alienated parent, and the child's need to have a relationship with that parent. This is profound psychological child abuse that is beyond the conception of the professionals in the field, and they should be staying current in this area. And unfortunately, a lot of us in the field are unscientific. We do not do what we're supposed to be trained to do. If the medical profession conducted themselves like the mental health profession conducted itself, it would be in utter chaos. That's what we do in the mental health field. We accept the word of the child, the programmed, brainwashed child, and the alienating parent. We rarely, if ever, check the story out with the other parent, and we believe the patient sounds credible. They sound believable. Well, of course they do. A person with a personality disorder is expert at mimicking normal behavior. So they fool all too many people in my profession. And when the clinician relies on just what they're reporting, it's relying on what's called intuitive reasoning. In a counterintuitive case, like alienation is, it's profoundly counterintuitive. You can't just rely on intuition. Too many people in my profession, in the legal profession, believe that the child is credible when they say, I don't want to see a parent, I hate that parent, I never want to see him again. Oh, why? What did that parent do? And actual kids have reported to me with a straight face, teenagers, we hated the trip that he took us on to Hawaii last year. And I looked at the father and I said, you know, I've never been to Hawaii. Will you adopt me? I mean, so these are just incredible, bizarre explanations that are taken seriously. We absolutely know that to have an experience of not having a parent meaningfully in the child's life portends for huge short and long-term negative consequences in forming peer relationships, in issues with trust, in issues with anxiety and depression. We have ACE studies, adverse childhood experiences, in which parental dysfunction and the mental illness of a patient, like a cluster B personality disorder, mental illness of a parent, are those experiences. And the ACE studies will show that there is a permanent restructuring of the child's brain from these experiences for the negative, like not making connections for empathy, which means having empathy is the basis of being law-abiding. Not having empathy is the basis of sociopathy, antisocial personality disorder. Why would anyone want to permit those kinds of situations to continue? First of all, we do need to start training mental health clinicians in what this is, and child protective service workers in exactly what's going on here. We need training for them to realize how suggestible children are. That's the first thing. We have research now from Elizabeth Loftus, for example, and Julia Shore, that a researcher can implant a false memory in the subject in as little as the third weekly interview. She managed to implant a false memory in college students, not exactly a dummy population, that they had committed a crime in adolescence. Well, you know, there's not that long a distance, time-wise, between adolescence and college. What the crime was that that the subject had gotten into a fight with their best friend that got so badly out of control that the police were called. And their friend had to be obviously hospitalized or whatever. She was successful in implanting this memory in 75% of the subjects. 75%. Whopping statistics that implanting a memory such as that. Now, when you think about a minor child dependent upon a parent for love, approval, and nurturing, who has contact with a parent incessantly, how easy it is to implant a false memory in that child. A false balloon ride. Kids were convinced they took, that they never took, lost in the mall. So there's lots of research that CPS doesn't know about. I can't tell you how many cases I've reviewed as an expert where the forensic evaluator had absolutely no training on the suggestibility of children. And so they did nothing in their report to raise the alternative hypothesis to the child is telling the truth, to the child was influenced, as to rule out this suggestibility by the parent. This, by the way, doesn't meet the standard of care. And this, to me, is also malpractice. We have an obligation as clinicians to generate all plausible hypotheses to explain the clinical presentation, the manifestations or symptoms of the patient before us. And we don't do that. The evidence was that they would rather rely on their intuition. I'm looking at your face. I know what you're saying is true. I know what you're thinking is true. Are we that good that we can do that? It's a travesty, and yet parents are being accused falsely of sex abuse. Terrible, terrible. If a child believes the false story that they had been sexually abused by a parent, they are at the same risk potential for PTSD as if it actually had happened. This is criminal behavior, absolutely criminal behavior. The alienator is assaulting the child's memory, feelings, thinking, relationship with the parent. Assault is a crime, and it should be looked at that way. The non-specialist in alienation will say, oh, this is a relationship problem between a child and a parent. I know how to treat that. Well, there's a world of difference if the child is rejecting the parent for legitimate protective reasons, or it's a result of a brainwashing. Very often, clinicians will accept the word of the parent and child who say, my child is going into a state of panic, they're getting nausea, they're threatening suicide, just at the mere fear of having to see their other parent in the protective environment of a therapist's office. This is nonsense, absolute nonsense. They haven't seen a parent in 3 or 4 years. You're going to tell me that just the mere threat of seeing that parent is going to cause suicidal threats? If that's the case, then their alienating parent is not teaching them how to cope with life. People often say they have to show genuine support for the relationship. Well, they give words. How do you know? Well, actions speak louder than words. I say immediately, you have to be able to reason backwards. When the alienating parent shows genuine support for the relationship between the other parent and child, you know it in how the child behaves. They will accept the other parent like this, like a light switch. I have had kids who come into my office during an evaluation for alienation, and they will go into the face of their alienated parent. We hate you. We never want to see you again. We're never going to your sleazy apartment. Forget about us. Move on. Marry someone else and have kids with that person. This is an actual evaluation I had done. So the alienating parent knew she couldn't fool me, that I knew exactly what was happening. And I was getting ready to say she's an alienator, and the only remedy in this case is going to be take away custody, at least temporarily, to see if she gets help. So she looked at the father and said, I want to resolve this now. So I said to her, okay. We sent the kids to the waiting room, and I said to her, and she said, okay, how about starting weekend visits this weekend? And the father said yes. And I looked at the mother and I said, but you have to tell the kids. We called them back into the room, and the mother looked at the kids. They were 9 and 11 at the time. And she said, your father and I have ended this. No more fighting. You start your weekend visits this weekend. The reaction of the kids, okay, Mommy. That's how fast it was. We're never going to your sleazy apartment 40 minutes earlier. Forget you have children. And that's what happened. And they went that weekend. If a parent is violating court orders, withholding the parenting time, lying about false allegations of abuse, manipulating your children to lie, I mean, these to me are antisocial behaviors, which are the worst because, unfortunately, they are not amenable to treatment. Borderline and narcissistic are difficult, but you can make headway with them. So yes, those are serious personality disorders. The only way that they will comply is if there are real consequences from the court, like the threat of losing custody permanently or high fines. Some people suggest jail time. It's not my favorite remedy. I think it would be a last resort. I don't want to make a martyr out of the parent, but usually the threat of permanent loss of custody, well, at least they can't do any more child abuse if they don't have custody. And you know, I can't tell you how many non-specialists in alienation will say, oh, yes, it's alienation. Yes, I do agree alienation is child abuse, but it would so traumatize the child to take them away from the abusive, alienating parent. Well, first of all, that's pure speculation. There isn't a single case in the clinical literature that I know of so far that documents any trauma to a child from being removed from that environment. As a matter of fact, the research shows just the opposite. They're being freed from the loyalty conflict. They no longer have to choose. They no longer have to repress that instinct to love a parent and cut off half of themselves. So it's a freeing of the child. In family therapy, we don't believe that talk changes people. We believe that corrective experiences change people. And we have all these expressions, actions speak louder than words. When a child has aged out, it's really heartbreaking because there's no overall authority that can put pressure on the alienator, stop your naughty behavior. It's no longer considered child abuse. So it's really heartbreaking. And first of all, I tell alienated parents, nobody walks in your shoes but you. Only you know when you can no longer take the stress of fighting, of putting yourself through sending email after email and text after text and not getting responded and being blocked. You have to nurture yourself. You have to take care of yourself. You have to know you have a life. And I hate that advice, but sometimes that's the only advice we have. The research shows that the adult children who have the best outcome, they never have good outcomes, but the best outcome with less anxiety, less depression, less use of drugs and alcohol are those young alienated adults whose parents did not give up, who kept fighting. We know that there is virtually no risk so far that we know of anything to doing a removal. And when you think about it, the same judge 15 minutes earlier on a case removed children from Child Protective Services case and placed the child with strangers. And there was no qualms about it. Now we're saying, Your Honor, we want to place the child with a loving parent who has no abuse and neglect, no indicated cases of abuse and neglect. What is the trauma? How come it's okay to place a child with strangers but not with another loving parent? So you have to do that risk-benefits analysis to know that we know what happens when you're living with a personality disorder, like a borderline, has a much higher suicide rate than the general population. This is being modeled for the children. A child being raised by a borderline has a greatly increased risk to becoming borderlines themselves. It's no accident that so many of these children are threatening suicide. do a causal analysis. These children were functioning normally prior to the onset of the alienation. All of a sudden they're suicidal and they're cutting and they're anxious and depressed. Well, obviously there must be something going on in the alienating environment. So do your job, therapists. It fails to meet the standard of clinical care, which is malpractice, another word for malpractice, when a clinician is practicing outside of their area of expertise. So a lot of these therapists they may not realize they're doing it. Well, that ignorance isn't bliss. First of all, when the alienating parent alleges alienation, you have an obligation then to say, let me explore this, and is this my area of expertise? And if I don't know the 8 manifestations, and I don't know the 17 alienating strategies, and I haven't taken a CEU course, and I wasn't trained in family dynamics, and I've never been to a conference like PASG, and I don't collaborate with one single known expert in the field on alienation, this is outside my area of expertise. I have an obligation to do one of two things. Get an expert to supervise me, or say, you know what, I'm in way over my head, I have to pass this case, I cannot treat it.